If you have bladder problems, there are some simple things you can do. The first thing, again a component of healthy aging per se, is exercise. There's evidence to show that either in fairly robust community dwelling older people that a 30-minute walk can reduce the need to get up at night to pee, improve sleep quality and improve quality of life. You might remember, as we said, that if urgency is a problem and you have a little time or maybe less time to respond to a full bladder, then increasing your walking speed and stamina is a very good thing. In fact, the loss of mobility is probably one of the greatest risks for maintaining continence that we know about. So exercise to maintain mobility is therefore extremely useful. One thing that men and women of any age should practice is pelvic floor exercises or Kegels. The women listening in will remember those from when they were pregnant, after pregnancy and before birth. But simply this is an exercise to tighten that sheet of muscle at the bottom of your pelvis, which gives you support to your pelvic organs. It has a twofold use. In stress incontinence, it increases the strength of the valve at the bottom of the bladder to reduce leakage on exertion. It also improves the support for the bladder and the pelvic organs, which can protect the bladder from leakage when you move around. Likewise, pelvic floor squeezes can turn off a contracting bladder and give extra time to respond to urgency. So, if you want to do a pelvic floor squeeze, how do you do it? Well, let's go to basics. You imagine that you have the Pope or the Queen to tea, and you need to fart, but you're far too polite to fart. So you practice at holding in a fart. If you feel when you do that your bottom squeezes in and moves upwards, and that is your pelvic floor contracting. Now, men can check whether they're doing that right by stripping off naked in front of a mirror, and they will see their penis doing this when they squeeze their pelvic floor. Women can feel inside their vagina if they really want to, and feel the squeeze as well. Now, to be of good effect, you need to do 10 squeeze and hold for up to 10 seconds a time, and do 10 squeeze and holds 3 times a day. You need to do that for at least 4 months to have a good effect, and to continue if it has benefit. So, pelvic floor muscle exercises are if you like, the mainstay of treatment for many kinds of incontinence. If you can't manage to contract your pelvic floor or feel you need to help, then there are physiotherapists who specialise in this all around Edmonton and the surrounding area. You can find lists of those available on the Alberta Health Services website and by doing a web search. The next thing you ought to think about is something called bladder training. If you do find problems with holding on in the face of needing to pee or have urgency, you can do bladder training. You get used to holding on a little bit, and then you gradually extend that holding on bit by bit and aiming for a 3 to 4 hour space between going for a pee. And that is a good treatment for urgency, frequency and urgency incontinence. If you're really keen, you can drink even more and hang on like billy-o, and people do things like crossing their legs, sitting on a hard surface, even diverting their mind completely to try and hold on for as long as they can. This is a technique called bladder drill or bladder retraining and has been found to be very useful. So what do you do if those things don't work? Well, for stress incontinence, if a good trial of pelvic floor muscle therapy hasn't worked, even in the supervised hands of a physiotherapist, then a surgical option for treatment is often the next effective thing. There are many different kinds of surgery which can be range from a simple outpatient appointment through to an overnight stay, and these can be extremely effective and have been shown to be effective even in people in their 80th and 90th year. For urgency and urgency incontinence, then there are a number of medications available. What these medications do is control the sense of urgency, allowing people to hold on for longer and reducing incontinence. There are a variety available, all of which may suit some people more than others, and your clinician or healthcare provider can advise about that. We mentioned troublesome getting up at night, or nocturia. Nocturia is quite a complex symptom and isn't always due to a problem in the lower urinary tract. It can be a problem due to, say, other diseases such as diseases of the heart, or because of medications which might make ankles swell. It's always worthwhile getting checked over by your healthcare provider if nocturia is troublesome. We said that getting up 2 times or more tends to have an effect on quality of life, and it seems that the reduced time between going to sleep and getting up the first time is an index of real harm, if you like. The less time you can sleep, the greater the problem. Again, nocturia is treatable, but other diseases or treatments may be tried before medications for the bladder, or medications to reduce the amount of urine the bladder makes, or bizarrely, we can use one of those tablets called a diuretic at least 5 hours before bedtime, so your kidneys produce more urine in the day, reducing the amount of urine at night. And again, your healthcare provider can supervise treatment and ensure that it's effective for you. Many people will also need to use what's called containment products or pads to manage their incontinence, maybe while treatment is becoming effective, or because of security when out and about.